4 questions every nursing student should ask when you're studying anything in nursing school. This will help you identify the most important information, make sure you're connecting the dots and really understanding, not just memorizing the information, and make you feel confident when you are seriously done studying so that you can get comfortably passing grades on every exam. And this comes from my Silver Bullet study system because basically one question is associated with each of the 4 steps. Question number 1, what do I need to know about normal before I can begin understanding this topic? This is how you identify the most important information before you even know what the most important information is. Because even if you're a brand new nursing student, even if you're a pre-nursing student, you are smart enough to always be able to identify something, and it's only normal stuff. So for example, if you're studying pneumonia, you'd be like, pneumonia has to do with your lungs. I better know my anatomy and physiology of the respiratory system. Question number 2, what has broken or changed with this disease process? Side note, the Silver Bullet study system can be used for to study not disease processes. So if you need to study pharmacology, drugs, or a normal topic in fundamentals of nursing or something. But I'm going to focus on using examples from disease processes today in this video. But with question 2, we say what has broken or changed? You have to compare it to normal. So you're already connecting the dots. You have to know what normal is in step 1, question 1, in order to be able to accurately and easily define what has broken or changed. This is kind of like the pathophysiology, but you have to break it down like a 4th grader and explain it in everyday words to understand it better. Question number 3, given what I know about normal, given what has broken or changed, what is going to happen next? What's going to happen differently now? And this is where most students have the biggest light bulb moments when they switch to studying with the Silver Bullet study system. Because suddenly, instead of just being faced with this overwhelming spaghetti brain of possible symptoms that sometimes happen, sometimes don't, some are better, some are worse, some sound bad, but they're kind of normal and expected. Now you're going to look at that list of symptoms. You're going to be able to group them into symptoms that all kind of have the root cause. They all kind of go together, and you're going to understand exactly why every single one of them happens. When you do that, you no longer have to memorize them because it's just common sense. You're like, well, I memorized normal. I know what normal does. I know what has broken or changed. So it's not going to do it's not going to do its normal job. It's going to do this instead. And you can just predict things. Can you see how powerful that would be on an exam? That means that if you get a test question where you have never studied that topic before, but you can go through this process kind of on the fly, you can still evaluate a symptom and be like, does that make sense based on what I know about normal and what has broken? And you can make a really, really good educated guess and probably get that question correct. Step 4 is a lot like step 3, except we're talking about nursing care now. So the question is, what are we going to do about it? That's the 4th question. What are we going to do about it? So given what I know about normal, given what has broken or changed, and given what's going to happen as a result, what are we going to do about it now? And what we're going to do about it, we tie it back to each individual step. There's things we're going to do related to the symptoms. There's things we're going to do related to the root cause. Are there things we can do to reverse or repair or fix the root cause? There's things we might want to do to educate the patient or to try to prevent them from ever having this or to identify risk factors. So step 4, what we're going to do about it, we tie it back to each of the previous steps and questions that we asked in steps 1, 2, and 3. And honestly, everybody jumps to the nursing care. What do we do for nursing and medical care? I need to know how to prioritize nursing action. But as a professional nursing tutor, I actually find that I tutor the least on this step. And the reason is because if you study steps 1, 2, and 3 solidly, step 4 becomes a cakewalk. Step 4 is literally obvious to you now, and you don't even need me to explain it to you. So if that sounds good to you, because my job is always to tutor myself out of a job, okay? I want you to become an independent self-learner and an amazing nurse. So I have a couple of ways for you to learn how to study this way for yourself. First, I have a free Silver Bullet study system overview. It's a 10-minute video that you can watch anytime. You can go to my bio link and request that there. But I also, at the time of this recording, I have a pre-nursing boot camp coming up soon. And that's I'm going to cover 4 essential nursing school topics. I'm going to cover, of course, the Silver Bullet study system. Also, I'm going to teach you how to do dosage calculations the easy way. I'm going to talk about time management and test anxiety. You can get all 4 of those topics included in the pre-nursing boot camp. So even if you're only interested in one of them, it is worth it. If you've already missed it and the live class, then I should have the recordings available, and you can also get information about how to purchase those or send me a message if you can't find the recordings to purchase. Here's to your nursing school success, and good luck on your nursing school journey.